Women have remained the most historically marginalised group within the bleeding disorders community. Despite reporting symptoms similar to their male family members with bleeding disorders, women and girls have been routinely ignored. Through projects such as this one, we aim to preserve the voices of these women, ensuring these voices are consistently heard. And through the continued education of the public and medical professionals, we aim to create for women real parity and equality in diagnosis, treatment and care. So tell me again about your first visit to a healthcare professional and what happened.
The very first was when I had my nose cauterized as a child, but nothing ever was suggested about hemophilia or bleeding disorders or anything. They just said that it was dryness in my nose. So fast forward through many bruises and bleeding episodes throughout my life where I was just told that it was normal. That's what happened in our family. I had quite a number of children. And after my very first, I was 22 and went into shock. And I was scared. I didn't know what was happening. And then I had the second one, the same thing happened. And we inquired, why am I going into shock? And they said, oh, it's just from the blood loss. And I asked, if the blood loss was so severe, why weren't they doing anything about it? And they said, well, it happens with childbirth. And it kind of got brushed off. And I had a placental abruption that caused a great deal of bleeding, and they still weren't worried. So after I had my twins, I had my tubes tied, and my bleeding increased, so I had a uterine ablation. And that was the best thing that I could have done for myself in terms of being functional and being able to leave my house every day of the month and not have to worry and plan my life around a period. But the first healthcare professional that I saw was the rheumatologist who ran some blood tests just on the basis of my symptoms. And while we were looking for something rheumatologically related, she found von Willebrand's and hemophilia A. I was referred to the Hemophilia Treatment Center, the local one, and got tested, and they said, certainly do, after all those years.
How old were you at this point?
38. I remember specifically, it was January 30th of 2008 when I had my blood tests. And it all made sense then when I got those results.
And what's happened since then in terms of the care you've received?
I have been following with the only hemophilia treatment center that's around this region for all those years since 2008. I had my children most of my children tested. Some of them have bleeding disorders and 2 of them do not. And we progressed, through the different stages, and we saw the research team and the physical therapists and the social workers and all of the very helpful people at the treatment center. And I've had a number of musculoskeletal surgeries, major spine surgeries. And I've had some good response, some not so good response from the Hemophilia Treatment Center in regard to medicating.
Do you have any advice for other women with bleeding disorders when visiting healthcare professionals?
Yes. If you feel there is something wrong, pursue it. If you think that they're brushing you off or not taking your opinions into consideration, pursue it. And if you need to have a referral for your insurance company, please ask the PCP for a referral. Go to the Hemophilia Treatment Center. There are many bleeding disorders, and the blood tests that a PCP will run are not necessarily the ones that are going to show that you do have a bleeding disorder, whereas the hemophilia centers are able to figure out what sort of disorder you might have.
Super. Is there anything else about your story you'd like to share with us?
I've used several different products, and I've talked to representatives, and they are also a very good information source, I suppose. Of course, they want to sell their product, but they can give you great amount of education on what you should be feeling.
So thanks, Jess. That's brilliant. We do appreciate you getting involved. Thank you so much.
Thank you. Yes.
Take care. Okay. Hi, Connie. Could you just begin by telling us how your bleeding episodes begin and progress?
I don't mind at all, Paul. Thank you so much for this opportunity to share my story. My name is Connie Lee Montgomery. I'm from South Carolina, and my bleeding disorder started with, of course, the nosebleeds that last about 12 to 15 minutes, and then it progressed on to the bruising, and then through the pubescent years, the extremely long menstrual cycles, and all that comes with bleeding disorders, and the joint pain that was significant and joint swelling.
And, when was the first time you had a visit to the healthcare professional and how did that go?
It was during my pubescent years. My mother took me to the doctor to see what was going on because the menorrhagia was horrible. The pain was terrible. The passing of extreme clots with my menses was terrible. And the bruising was significant, bled on and through my clothing. And so as it progressed and got worse and worse, Mom took me to a physician. We shared my story, and that was unusual for us right there because, Mom taught us that, if you have an illness, a sickness, or a weakness, that type of information you kept in the home because you didn't want people to make unkind judgments about you or there be some type of stigma. So we were taught to, what happens in the home stays in the home, to learn and to deal, but we had to reach out because we were desperate. And suffering in silence was not the answer. So once we got to physicians, shared what the symptoms were and what was happening with me, there was no additional follow-up or follow-through or additional questions asked. And even when we changed physicians and went to another doctor, healthcare practitioners just didn't ask any further questions or do any further evaluation. And sometimes, as I got older, I noted that they would just say, well, you're exaggerating about the condition. It's not that bad. It's not, that awful. But it wasn't until my mid-30s and a horrible car accident that changed that. But that was after I'd had 2 children via emergency C-section and, bled extremely afterwards for like 6.5 weeks. So took a lot to get a proper diagnosis. And it wasn't until after a car accident in my mid-30s that we actually got a proper diagnosis. And it was shocking because I was born with factor 7 deficiency, a congenital rare bleeding disorders. I was born with it. It had been with me all my life, but didn't get the diagnosis until a knowledgeable ER doctor and a hematologic consult in an emergency room after a car accident changed the game.
Why was your condition ignored or just put to the side?
I think there's several factors, Paul, that I did not receive a timely diagnosis. First, I'd like to say I absolutely wish there was newborn screening for people with symptoms or babies born with symptoms that are unusual. That would help a lot. The next thing I'd like to state is that definitely here in the United States, healthcare disparities are real. And having healthcare practitioners, because I'm a retired healthcare practitioner myself, I became an occupational therapist after many, many years of school and all of that. And I practiced for a number of years. And I don't think people listen and listen well, especially to people that don't always look like them or sound like them or have the same belief systems. And I think a lot of that played into that. I mean, I'm in the Southeast, geographically, of the United States. And so I just think healthcare practitioners did not hear and listen to the symptomology that my mother and I got up the nerves to share when we did share about what was going on with me, especially during the pubescent years. So that contributed. And I think unconscious and sometimes conscious bias led to them not listening. So it's multiple factors that led to me getting a late diagnosis. And another part is just a lot of physicians and practitioners, they're just not aware of such rare disorders, because they don't see it often. So all of these factors contributed, I believe, to me getting a late diagnosis, extremely late diagnosis. But most women aren't diagnosed until 16 years after they've been living with it. I just had double time. And I do think that's due to healthcare disparities and things of that nature, and unconscious and conscious bias. And of course, where I was located geographically, and a lack of knowledge and understanding and education on the part of the practitioners, and even the ability for them to listen and listen well to what was being shared.
And being diagnosed, has that had a big effect on your life?
Absolutely. Absolutely. Being diagnosed with a bleeding disorder when I was first diagnosed, let's just be real, it was overwhelming for me. Even though by that time I'd become a healthcare practitioner, like I stated, an occupational therapist myself, but learning that I was living with a rare bleeding disorder, that was a lot. That was a lot to take in. And so, of course, for a while, initially after the diagnosis, I went through a period of depression. And that was quite hard and overwhelming for me because I'm a go-getter, I'm a doer. But it was quite hard to be that way, knowing that I had this rare bleeding disorder, and then learned that I had another rare disorder, pemphigus vulgaris, which was autoimmune. So at that time, I learned I had two rare disorders, hypertension and diabetes. And so it was quite overwhelming.
And what advice would you give, Connie, to other women when visiting healthcare professionals? With these concerns.
The main advice that I would give to other women visiting healthcare professionals, whether they've got a rare bleeding disorder, autoimmune disorder, or just have some health challenges, I would say advocate for yourself regarding your symptomology until you are heard. And then once you have shared it and you've gotten your diagnosis, the proper diagnosis, get involved, learn about your disorder, disease, or condition. And after you do that, keep yourself abreast. Go to conferences, participate, and advocate for yourself and those that will come behind you. Hopefully, a legacy where you can share with people that it's okay. Our diagnosis does not define our potential. We can go and do great things. I've written a children's book, Letter Forgives. I speak all over the country and have gotten involved lately with speaking abroad as well. And so our diagnosis does not have to define the directions we go in life, our potential, and the things that we want for ourselves and how we can help other people. Use your adversity to propel you forward to give other people opportunity.
Is there anything further, Connie, you think that we've left out that you want to add?
Yeah, I would like to add the fact that even though you may be born with some health conditions and culturally you may be taught a different way, you have to do what is best for you when it comes to your health care. In my family, it was not recommended that you put all of your family business, as we would call it, even medical business, out on the boulevard. However, if it will help you live an improved quality of life, You need to go out and seek the information that you need so you can have the best quality of life you can have as a woman, as a person, as an individual.
Super. Thank you so much.
You're quite welcome.
Thanks, Connie. Hi, Priscilla. Thanks for joining us. So could you just begin by telling us about kind of the history of your bleeding episodes, how they begin and how they progressed?
Well, as of Thanksgiving Day, I will have spent 74 years in the hemophilia community. So I'm one of the matriarchs, may I say, and I've had a lot of experience. My life revolved around hemophilia, actually from the day I was born until today. And I have your list of questions, Paul, that you posed about how did your bleeding episodes begin. And I wrote the biography, which is longer than many because I've had no more experiences than many. My first memories of life, I was actually dying. I was in the hospital for weeks, bleeding from an unnecessary tonsillectomy that they don't do today. And I know many hemophiliacs are diagnosed that way by having an incredible bleeding episode, sometimes with tonsillectomies. I know a number of women who have had the same issue. And you cannot think of a person with hemophilia going through a tonsillectomy today without being treated. So that was my first memory of life. And it went on for weeks, and I was in the hospital for weeks, and I almost died. And I had multiple transfusions, because it was whole blood. We didn't have anything else at that time. That would have been about 1955. And so I received, my mother told me, the equivalent of about a dozen whole blood transfusions. And most of my donors would have been ex-GI soldiers because my father was in the World War II. So the donors probably would have been ex-GI. And my memory of that is a vivid thing that sticks in my head. And back then, when they couldn't stop the bleeding, they tied my head down to the side so the blood would drip into a metal pan rather than go down my throat. Because if you get blood down your throat, you're going to vomit it. So I had to have my head tied down. They also would come in and stuff my nose with gauze. And as soon as they removed that gauze, it would gush. And I can remember them telling me I wasn't allowed to cry, because if I cried, it would remove the clots. And so I can remember the little me standing at the window at the hospital looking out as my mother was leaving and trying very hard not to cry. Eventually, what stopped that bleeding was a woman intern who took a long object with silver nitrate and cauterized the area that was bleeding. But in the meantime, being malnutrited and very sick, all of my pictures as a child, I looked like a waif with round shoulders and very pale because I was anemic. They didn't know what was wrong with me. Years later, I got my medical reports from that hospital experience. And in the report, they said there is hemophilia in this family. However, this cannot be because she is a woman. Therefore, it must be a vitamin K deficiency, which of course it was not. Going on through my life, I always had bruises. I always had issues that would have been recognized today. One of the other vivid memories was pain in my legs and my knees. And when I'd complain, my parents would say, "Oh, those are growing pains." And a lot of kids got that too. But hemophiliacs now, bleed into joints, bleed into muscles. I was not diagnosed with hemophilia until I had a son with severe hemophilia. But along the way, like most young women who need the attention today, and that is why I'm doing this, is for the women, the younger women, who won't have to go through what I went through. Periods were terrible, but back then you didn't compare yourself because we didn't talk about such things. So yes, I had terrible periods that young women get. Today they're being treated so they don't go through that. And then when I had my child, my first daughter, I didn't bleed during the pregnancy because the factor level in women goes up because of the hormone levels. But postpartum, I bled so much that they gave me cryoprecipitate. Still, I was not diagnosed as a person with hemophilia. And the other memory don't have, my brother died. He was 13 months younger than me, and he died on the day he was supposed to be baptized. And his death was contributed to crib death. However, my sister and I got his autopsy report from the hospital years later, and indeed he had a brain bleed. So he probably had hemophilia, again, that was undiagnosed. The only hemophilia in that generation, my generation, was a cousin who was severe factor 8. Although my history goes back several generations to Germany, and we were able to trace some of that because my great-grandfather was a hemophiliac and a physician in Germany. So the loss of my brother, that would have been 2 years before I almost died from a tonsillectomy, significantly affected my mother, as any mother who loses a child would. After I had my son in 1971, Dr. Oscar Ratnoff at the Cleveland Clinic was conducting a study of women with a history of bleeding because in his HTC role, he saw mothers and sisters exhibiting bleeding patterns and bleeding histories. So he did a study in 1973, and I have a copy of that study that I posted. He found that a third of the carriers of severe factor 8 at that time had low enough HAV levels to be considered hemophiliacs, but we weren't called hemophiliacs. We were called symptomatic carriers. That lasted a long time as a symptomatic carrier. However, when you need medical care, that is a genetic determination and not a medical determination. And so they finally had changed our status to being mild hemophiliacs. Now I am very much involved in the women's movement to get women recognized so that the women do not have to go through all that I went through. I did have to have an early hysterectomy because of bleeding. That was very common in my generation. But today it has lasting effects because now I am postmenopausal and having significant issues from having an early hysterectomy. One of the things that is really affecting me right now is the pain in my joints. I have arthritis in every joint, including my back, my spine, my hips, my shoulders. Every joint has been affected. One of the things that they can't tell is, was that from hemophilia or is that from aging with arthritis? That's still to be determined. As I'm following the webinars for women today and the movement for women, a lot of things are coming out that were not available to me, like the musculoskeletal ultrasound that can actually determine blood versus fluid, synovial fluid.
So when was the first time that you were diagnosed?
During that study done at the Cleveland Clinic, Dr. Oscar Ratnoff, that was the first time I was diagnosed. I was diagnosed with a low clotting factor, below the standard that is set. I think it's either 40 or 50%, and in that study was 18%. mild males would go under those same conditions, but females just were not paid any attention to. Males were treated because they had basically large knee and ankle hemorrhages, and my son did too. But a woman, and we never even heard of microbleeds. That's just a new term, and a lot of people don't believe that's such a thing, and some people say that's a bleed. Doesn't matter if it's called micro or whatever, you've got to bleed. And I am still trying to negotiate the treatment that I think I should have. I am the only female at my hemophilia treatment center because we have a pediatric one where most of the young girls go. But the adults, I am the only adult female with a factor VIII deficiency. And a lot of my experiences have made me very conscious of how I am the one who has to know what I need and when I need it. I do have home nursing services. I do have factor VIII in my refrigerator now. When I had surgical procedures, I was treated with almost 100% level, as would be expected with other males. The main difference between males and females is the fact that the female factor level can vacillate over time. In fact, the factor VIII level goes up, well, then you can't be tested accurately if you have your period because the factor level is going to change. My factor level has fluctuated significantly over the time period, and I have records of all of my factor levels being done. As one ages, from what I'm told, your factor level actually goes up, and now my level's at about 30%. That is still hemophilia mild. I still need care. I still need to be conscious of my own body and what's going on with it.
Do you feel that you're getting the care that you need now for your hemophilia?
Oh, I think all women today are still fighting. I'm sorry about this. I think women today are more vocal, and the young women are more vocal. It's very rare to be a female with hemophilia. However, from what I understand, now that they are testing the daughters and the mothers of hemophiliacs, there's more females now than males with hemophilia. Now, I'm factor VIII, and I'm speaking solely from a factor VIII position. I know that there's von Willebrand's and there's factor IX, and so my experience is not like theirs because it's different.
Yeah.
And I think what I would really like to be able to do with this is educate people so that young women, when they think their joints don't feel right, that they get treated. Because over a period of time, and I'm only speaking from my medical knowledge. I'm not speaking as an expert. I'm speaking because I've attended many, many webinars. And when I said my whole life has been dedicated to hemophilia, from the time my son was born with severe factor VIII, I got involved with the National Hemophilia Foundation. I was on the board of Pittsburgh. I learned everything I could. We started treating my son at home when he was only 2 years old. And it was a difficult task to hit veins on a small, squirmy little kid. However, he is now 51 years old, and he's in a very well-preserved state physically because we aggressively treated him. However, we were also part of the HIV epidemic. My sister had 2 hemophiliac sons, and that changed our lives totally, the HIV epidemic. And there's not much you can say at this point except it was horror. There's no way you get out of that unscathed. There's no way you get out of that without anger and bitterness, at least for me. I never could have grandchildren, not because of hemophilia, but because of the HIV epidemic. And so today, I sit here with severe pain in my knee, my shoulder, my ankle. I'm facing the possibility of having to have those joints replaced. And I don't think I can ever endure surgery to do that.
My only other question is, and you've answered it in some ways, is, the advice you'd give to young women with a bleeding disorder when facing healthcare professionals.
First of all, be an advocate for yourself. Make sure you are aware. If you have any family history of hemophilia, get tested. And I think that is happening. A lot is happening already. The pharmaceutical companies are putting money into finding women like me early so that they can be treated. Going through periods in high school when you're bleeding profusely and you have to leave is just humiliating. And I was the only female in my family who had hemophilia. So I had no one to compare myself to. And I think frequently throughout my life, with the pain I was in, with the bleeding I was in, it was almost like I was treated like a hypochondriac. You can't make up blood flow. It happens. When I had teeth pulled, I bled profusely. No one knew why. No one ever bothered to know why, because women just didn't have that problem. Now, of course, we know they do. So my advice is, if you have a history of hemophilia in your family, get tested. If you have no history in your family, but you find you're bleeding that's not correct in relation to other young women or your mother, get tested. Because you don't have to have it in your family to be a female with hemophilia.
Thank you so much for your time, Priscilla. That was wonderful, and I do appreciate that. Okay, Lacey, thank you for joining us. My first question is really, just to really, if you could give an overview, a history of when you first had your bleeding episodes and kind of what happened.
So when I was 12 years old, I had a tonsillectomy and I hemorrhaged. So I had to go back into surgery and they cauterized my tonsils and I hemorrhaged a second time. And I had to go back in and then they stitched them closed. And they said the reason why was the holes were too big, that's what happened. And then I started a period, and periods were horrible. Sometimes they would be, I would have 3-4 a month. Sometimes I would go, 60, 70 days bleeding. I always knew, Mom always said, tell doctors your uncle has hemophilia. Tell doctors your uncle has hemophilia. But we never knew that it was, when my brother was born and he didn't have it, we knew that, it stopped with him. Girls didn't have hemophilia.
Sure.
And it got worse and worse and worse. Until I was finally diagnosed.
And how long was that? When did that happen and how?
I was diagnosed 2.5 years ago. I was at a meeting in a conference, and I was actually sitting next to the nurse for my HTC. And it was a meeting about women with bleeding disorders. And they had this list of 10 things on the board that you could qualify as a woman with a bleeding disorder if you could check off 3 of the 10 things. I checked off all 10. And I was going, I got that. I got that. I got that. And the nurse next to me said, I'm really interested in doing a women's clinic. I think you're our first candidate.
Okay.
And sure enough, like 3 weeks later, I went in and I had my first comprehensive visit.
And how has that changed, your life after being diagnosed?
Oh, so I started taking Factor to try to manage my periods. And I was taking Factor the first day, the third day, the seventh day, the ninth day, the 12th day,
Wow.
every other day. And after months of doing that, they realized, like, hey, it's not, they're getting slower and slower, but it's really not helping. She's still going through, boxes of tampons and pads. And so I had a uterine ablation that has changed my life. But it's not, now I know why, like, when I was playing soccer and what they called was an ankle sprain, it never healed, never healed, never healed. It wasn't an ankle sprain. It was an ankle bleed that I just kept re-injuring over and over and over. Which is now a target joint for me. Also, my left hip is a target joint. I have microbleeds in it all the time. And I still take Factor to try to deal with that, try to manage that. And it helps. My life has gotten a lot better since I've gotten the diagnosis. So I have mild hemophilia A and von Willebrand's 2M. I have 2 different bleeding disorders.
And why do you think it took a time for you to be diagnosed?
I think a lot of it is we didn't know. In our family, hemophilia came with AIDS and hepatitis C. So we didn't talk about it. We didn't talk about it at all until my son was born and diagnosed. Because that it brought up the AIDS stigma, and it was understood that my uncle had it, but we didn't speak of it. And when my son was born 13 years ago, we talked more about hemophilia in the first month of him being born than they had talked about in the last 30 years. And then it was finally like, after going to different conferences and this and that, okay, girls can bleed. We're not just carriers. And I feel like that's what it took that long to realize it. It took 11 years of me going to classes to realize, okay, I'm not just crazy. We can bleed.
What kind of advice would you give to young women who feel that they might have a bleeding disorder?
Keep going to your doctors. Keep going. Keep it. Advocate for yourself. Don't, the first time I got tested, my numbers, they were like, nah, you're normal. The second time I got tested, my numbers plummeted. As women with hormones and periods and pregnancy and all that. Our numbers fluctuate. We're not like the boys, that have consistent numbers. But between the estrogen and everything else, our numbers fluctuate. So we have to go back different, multiple times to get a correct reading and find, if the doctor you're going to says brushes you off, find another doctor, find another nurse, get involved in every single thing you can get involved with for people, and find people that are like you, people that will empower you to, yes, you do have here you go, you're checking that checklist. You do have those, you have all the signs, but you got to be willing to find someone that's going to go the mile with you to give you your diagnosis. Because it's not an easy thing to do as a girl.
Sure. Be persistent, kind of.
Oh, 100%.
Super. Well, that was great. Thank you so much. So thank you for joining us, Dr. Sidonio. I just want to ask you why it's taken so long for women to receive a bleeding disorder diagnosis, and how we can move forward and make things better for women going forward.
Yeah, I think there's a long gap between, the start of bleeding symptoms, recognition by the woman or girl that the symptoms are abnormal or outside of what's considered normal, and then actually getting to the physicians and providers. And then, of course, there's the gap on our end in which we able to recognize what's normal versus abnormal and what kind of workup we need to do. So unfortunately, that often is, quite a long period of time. Previous data, when you look at von Willebrand's, it can take up to 15 years from initial bleeding symptom to recognition that there could be a bleeding disorder. We've done research on this and shown that we've sort of shortened that gap. It's less than a couple of years, but certainly I think we can all do better by recognizing when the bleeding is abnormal. And then the physicians really need to understand what is a typical presentation for a patient with a bleeding disorder. And in teenage girls and in women, oftentimes the first big bleeding symptom is heavy menstrual bleeding. And there's lots of different causes for it, but certainly it warrants an investigation for a bleeding disorder, even when there's only a few other bleeding symptoms that may accompany it.
And from now on, looking forward, what do you think women should do in the medical profession to ensure that takes place?
Yeah, I think there's a few things that women and girls could do to help us as providers be able to get them to get the diagnosis if it is something ultimately that they have. I think objective documentation of the bleeding symptoms is very helpful. So having pictures, so it's very easy to say, well, I had a couple of bruises here and there. And then when you show the bruises in unusual locations, very large, multiple groups of them, those pictures are much more powerful than the descriptions. Documentation, how often they're happening, for example, nosebleeds, whether they are accompanied by iron deficiency, anemia. So, and there are objective tools that are available to women and girls. They're called bleeding scores. There are a number available online in which you can ask the questions of yourself and self-complete them. There's something called the ISTH self-BAT. And, having that documentation, knowing when those bleeding symptoms occurred, and having some pictorial evidence of it is really helpful for us as providers. It allows us to really get a sense of what's going on, and hopefully subsequently order the right laboratory tests.
Thank you very much. Is there anything you could add to this?
Yeah, I know there's a lot of discussion over the years, and I haven't been in this field that long, but I feel like I've seen significant progress in the last 5 to 6 years. And that's not just from people telling their stories. I think that's really important. But I think there's been a concerted effort by the patient advocacy groups. I know the CDC has worked with those groups as well. Number of physician organizations like FWGBD that are focused specifically on the plight of these women. And there's a growing number of investigators throughout the United States that are leading these women and girls clinics. And I think really that concerted effort has demonstrated some improvement in these results. And obviously there's always more, and there's always, things we could do better, but certainly I see that there is an improvement. And so I hopefully people will continue to tell their stories at meetings, and help us, shorten the gap from time to bleeding symptom to diagnosis.
Thank you for your time. Thank you so much.
Thanks.
So thanks for joining us, Shelley. I just wonder whether you could give us an overview of your experience and when you were diagnosed. That would be great. Thank you.
Well, I'm turning 60 this November, and unfortunately, I didn't get a diagnosis until I was 56 years old. I actually didn't know that I had hemophilia, that I was a carrier of the gene, until I had my second son. And when he was circumcised, he wouldn't stop bleeding, and he was then diagnosed with severe hemophilia. It took me, he's 27 years old now, so it took me all that time to receive a diagnosis for myself.
And what had happened beforehand, in your experience, that made you feel that you did have a bleeding disorder?
Well, growing up, I used to always have to go to the emergency room. Weekly, my parents would take me at least 2 or 3 times a week, and they would have to cauterize my nose because it would bleed so much. And I remember that they would take this cloth and put it in boiling hot water, and then they would shove it up my nose to stop the bleeding. And after a while, it just became regular. And it's interesting because, you don't really think anything's wrong with you because they don't ask you questions, they don't diagnose you, you just keep going back, and they keep repeating the same thing to make the bleeding stop. And like I said, after Matthew was born, then I realized, wait a second, when I had him, I had a C-section. And they couldn't stop me from bleeding. They literally had to turn me upside down to keep the blood inside of me until they could figure out what to give me to stop my bleeding. And at that point, when Matthew was then diagnosed with hemophilia, I thought to myself, you know what? I bet you that I have hemophilia. This all makes sense now. All the bleeding that I had, all the bruising. When the boys, I have 2 sons, and when they were growing up, they were very active in sports. If I had my period during a time that they had a game, I couldn't even go to their games because I would be afraid that I would have an accident and I'd have to come home and change.
What happened when you first visited a healthcare professional?
Well, the interesting thing is that I went to a treatment center in the state that I live in California. I went with a friend of mine, and I had been diagnosed by my son's hematologist prior to this visit. And that hematologist happened to retire from the hospital. So I went back in for an annual visit. And when I went in, they actually looked at me and said to me, we're sorry, but, you don't have a bleeding disorder. And I'm like, wait a second, I was diagnosed with a bleeding disorder. And they were like, well, that doctor no longer works here, and we have to go off what our results show. And our results show that you don't have a bleeding disorder. So after that, I advocated for myself, and through different resources and groups that I belong to, I heard that there was a doctor in the state of Nevada that treated women with bleeding disorders. So I made an appointment, went up for a visit, and got my diagnosis up there.
And what's happened since that time?
Well, since that time, I've been infusing Factor. I have the script for Factor. I'm a martial artist, so I studied martial arts, so I tend to get bruised up sometimes and injured. And when I do get injured, I do a dose of Factor, and I could see an immediate result. I mean, my injuries heal so fast in comparison to when I would have an injury and I didn't infuse. It would take me weeks, months to heal.
And if you had advice for other women who, think they may have a bleeding disorder, what would your advice be?
Well, I think that the best advice to give anyone is that you have to be an advocate for yourself. And sometimes that could be a little challenging. As mothers, we're great advocates for our children. We'll do anything to protect them. But then when it comes to ourselves, we don't do the same thing. And I think that we need to just take a step back and we need to say to ourselves, look, I know I bleed. I'm a witness of it. I live this every single day. And if you do not get the diagnosis that you think that you deserve, you don't just give up. You have to keep going until you find the appropriate doctor that will diagnose you.
Super. And is there anything that you feel you need to add to what you said today?
Well, I just would like to add that I think that it's time that all of us women, we stand strong together, which we are all doing, and end this cycle of not diagnosing women. I don't think that women want to get a diagnosis so that they can say, oh yeah, I have a bleeding disorder. I mean, no one wants to inject medicine into their body if they don't have to, but we all want to make sure that we're protected so that if something does happen to us, we'll be treated properly.
That's super. Thank you so much for your time, Shelley.
Thank you.
That was great.